Today we will be making a CHD awareness wreath. I started with a dollar store green wreath form, and then I did a spiral wrap tacked on with a little craft glue and wrapped it tightly around, making sure just to overlap a little bit because we'll be tacking on some more ribbon with floral pins, and you don't want to overlap too much because it makes it harder to put the pins through. The pins I'm going to be using are 1 3/4 for this type of wreath. Anything bigger will go right through the wreath, and then you're going to have some sharp edges, which we want to avoid that. So I'm not going to show you the wrap, mostly because it takes a lot of time and a lot of out of camera view, because it just is a little bit more cumbersome. So I've already pre-wrapped it. I've let the glue set so it's nice and secure. So now I'm going to take what is this? Well, first of all, I used 1.5 inches ribbon with about 12 feet, so 4 yards of ribbon to wrap this, just a little under that. And now I'm going to take a 2.5 inch ribbon, and we're going to do it in red and blue. You can use any sort of ribbon. You just want something a little stiff that's going to hold the form well. So I'm going to start with a little fold. I'm going to take one of my pins. I'm going to do this on the top. I'm just going to push this through. There we go. Takes a little bit of muscle there. And then what I'll do, I'm gonna kind of pinch and fold as I go. I'm gonna try something a little bit different with this wreath. I'm gonna try kind of fold this under to kind of hide some of the mechanism of this, so we're not looking at so much metal pinnings. All right, and we're just going to continue doing that every couple inches. I don't have a perfect formula for this. No wreath I make ever looks the same as a wreath before it. Similar, but my technique always changes with each one. So it's a little bit of play. See what works for you. And my ribbon curls will be different sizes each time because I'm not a machine. So during our last video, I talked about Jacob and his congenital heart defects. So this time, I want to give more of a factual background of what exactly congenital heart defects are. Congenital heart defects are actually a problem with the heart structure that are present at and before birth. Some can be discovered during a fetal scan. That's usually what they do at the 20-week mark, and it's an anatomy scan to make sure the baby's growing properly. That's usually when they determine the gender of the baby. Some CHDs, some congenital heart defects, can be determined during that scan. Some cannot. Sometimes they don't get a good view. These are done with fetal echoes and ultrasound, and it's not a perfect science still. It's still the practice of science. So they're continuing to work on making better imaging to give us a better chance of discovering what is going on with the heart before the baby is born. But still not perfect. Another example, one of the examples, I gave Jacob's example of hypoplastic left heart syndrome last time, but one of the more common ones is holes in the inside walls of the heart, such as they're called VSDs or ASDs, ventricular septal defects, or atrial septal defects. That means there's oftentimes when you hear somebody say, oh, I have so-and-so has a hole in their heart, that's usually what they're talking about. There's a hole between the chambers of the heart instead of having a nice solid wall between them. They can also have leaky vessels, or not vessels, valves. So there are 4 major valves in the heart, and sometimes you can get some backflow across those valves, and that's what they mean by leaky. It means that the valve's not closing completely, and so you get some backflow of blood. Some more severe forms of CHD are blood vessels or heart chambers may be missing, poorly formed, or in the wrong place. Wrong place would be, as the name of it completely escaped to me. We've actually had some friends who've had that issue. It actually is where the heart is kind of flipped around. So the right chambers are on the left side and the left chambers are on the right side. And so vessels are coming out from different angles than what they're supposed to. And it makes it a little bit more complicated because the heart itself is not in the right place. And it affects how other organs are placed and how to approach something like that, because you have to go in and with a totally backwards mindset. CHDs are the most common birth defect. They occur in 1% of all births, or 1 out of every 100 births is a child with a congenital heart defect. Approximately 100 to 200 deaths are due to unrecognized heart disease in newborns each year. That's when it's not discovered during that fetal anatomy scan. When the child's born, they look great, their breathing's okay, but something changes rapidly, which can happen with even discovered CHDs. Things just can change in a moment. And one of the best things that parents can do when they first have their child, one, make sure you ask good questions during your fetal anatomy scan. You want to ask, are you looking at the heart? Are you looking at the chambers? Are they well formed? Are vessels where they're supposed to be? Just questions like that. The other thing is when the baby's born, ask for them to put a pulse ox on them. It's a very inexpensive, looks like a Band-Aid. It just checks the baby's oxygen. That can be one of the best ways doctors can determine if there's something else going on. And from there, if their oxygen is lower than the average, then they can start doing some other testing to determine what exactly is going on. And that's going to give that baby the best possible chance of survival. And then if there's nothing, if the baby's good, you've wasted maybe 5 minutes of time just checking their oxygen, and there's nothing wrong with that. Now, the number I just gave you, 100 to 200 deaths due to unrecognized heart disease in newborns each year, those exclude, so something has happened. They figured out that they have something, but they pass away before they can really determine what exactly it was, or before they could actually do something to change the outcome. It does not include those passing away before the diagnosis has occurred. Nearly 4,000 infants in the United States are born each year with CHD. That's just the United States. That number is even greater for the rest of the world. CHDs are as common as autism and about 25% more common than cystic fibrosis. Approximately 2 to 3 million individuals are thought to be living in the United States with CHDs. This is approximate. They don't know for sure because of HIPAA, you can't really know everybody who has it unless the parent or guardian chooses to make it known and share that information. I am getting all these factoids from mendedhearts.org. It is one of their fact pages. It is a great resource for newly diagnosed adults, as well as parents of newly diagnosed children. Mended Hearts also has a great support group for parents and those living with CHD. They fund research as well as all kinds of different things depending on the chapter. The number of people surviving with CHDs are greatly increasing each year. So that's wonderful because the research is helping diagnose people sooner. We have better surgical techniques. And it's getting to the point where the number of adults living with CHD is the same, is equal, if not greater, than the number of children living with CHD. So we are getting adults that have been blessed to be able to survive into adulthood with these congenital heart defects. Whether it's because they're mild forms of the defects or because surgical techniques, medications, are just improving to the point where people can survive and live long lives. But at the same time, congenital heart defects are the most common cause of infant deaths due to birth defects. So of the birth defects that occur, this is the highest mortality rate, are children with CHD. All right, so I am going to add a blue ribbon, same size, 2.5 inches. I'm gonna I want to make the loops on this one kind of overlap, but not go directly in the same place as the other one. Approximately 25% of children born with a CHD will need heart surgery or other interventions to survive, such as medications. Some CHDs, the children only need medication to help either improve the function of the heart, thin the blood a little bit more so clotting doesn't occur, but often they do need surgeries. And that is usually open heart surgeries where they actually open up the chest, crack the ribs, and work on a heart the size of a walnut. It's just astounding how detailed work that these surgeons have to do to give these children the best chance of survival. About 85% of babies born with CHD are now living to at least 18 years old. So they're living into adulthood now. 40 years ago, many CHDs, it was a death sentence. There was nothing they could do. So there has been tremendous improvement in giving these children a chance to live a life. Unfortunately, with the more severe CHDs like Jacob's and like many other children's, they are less likely to reach adulthood because the surgeries don't cure the problem. They're kind of the Band-Aid. For instance, with Jacob's, what they did with his surgeries were, because the left side of his heart didn't work properly, they were actually using the right side of the heart to do the left side's jobs or work. So after a time, the heart is working very hard and the muscle can fail in those instances, and the child then goes into cardiac or heart failure. And that's when other interventions have to be introduced, or at some points there is nothing more they can do, which was in the case of Jacob. They had done all the surgical interventions they could, and it just wasn't enough. His heart and his lungs just couldn't keep up with the demand, and that was just all they could do. And he wasn't a candidate for heart transplant because heart transplant isn't 100%. That brings a whole new set of issues. You're talking immunotherapy, keeping the immune system down to keep the body from rejecting this heart that doesn't belong to that body. Constant checks to make sure that the body isn't rejecting. There's a lot that goes on, so it's not a cure. There is no cure. It's just management, managing the symptoms, managing the disease, and trying to get the best they can out of best life they can for these kids. Oftentimes, surgery as a child will be followed by surgery as an adult. For instance, Kevin, who actually didn't even know he had a congenital heart defect until he was much older, is probably looking at, in the next couple years, of actually having to have some form of surgery, whether it's a open heart surgery or work done in a cath lab. We're not sure, but there is a good chance that he will need to have his valve replaced sometime in the future. those with CHDs also have other issues. Like Jacob, he had to have a G-tube because he just couldn't take enough in to grow. But even then, children with CHDs have a tendency of having a really hard time growing at the same rate as their healthy counterparts. They can have developmental delays, whether it's because of the heart condition itself, or it could be from the surgeries. These kids who have open heart surgery are put on bypass, which thins the blood and can sometimes cause brain bleeds, which can change how they develop. Anytime you change how the brain works, and with brain bleeds, you get injury to the brain, and then they have to create new pathways. So then the brain takes a little bit longer. It has to create new pathways to do what it's supposed to do in just a different way, because it now has this injury to it. Along with the CHDs, as they grow into adulthood, they can develop normal, healthy heart, well, relatively healthy heart conditions, such as high blood pressure, obesity, and acquired heart disease, such as hypertension, and other such diseases that the average adult may develop. As you can tell, I kind of changed how I was looping this midway through without even thinking about it. That's just how I do things. Biggest thing with this is you just make it how you want to make it. There's no wrong or right way to do this. It's just, you just want to make loops. Kind of make it puff up. So that's my wreath so far. I think I like it. The last one I did another layer of red on the inside, but I think I don't need that today. So what I'm gonna do next is actually make a bow to kind of tie this all together. So for that part, I'm going to take a 2.5 inch ribbon. This one has little hearts and angel wings on it. I'm going to take a pipe cleaner and I'm going to make a bow. And I'll start with a center loop. And then I twist it so that my nice, bright, colorful side versus the kind of dull side is facing out. This is a wired ribbon, so it holds its shape a little bit more. So it's gonna give you the nice, big, kind of fluffy loops. And I'm gonna make 6 loops on either side to make a nice full bow. The cause of CHDs are actually mostly unknown. Some, 15 to 20% of all CHDs are related to known genetic conditions. CHDs are often found with children who are born with Down syndrome. Also, it can be associated with trisomy 18, which are genetic conditions. Most CHDs are thought to be caused by a combination of genes and other risk factors, such as environmental exposures and maternal conditions. Because the heart is formed so early in pregnancy, the damage may occur before most women know they are pregnant. Environmental exposures that may be related to the risk of having a CHD include the mother's diet and certain chemicals and medications. Maternal diabetes is a recognized cause of CHD. Maternal obesity, smoking, and some infections also may raise the risk of having a baby with a CHD. Preventing these risk factors before a pregnancy is crucial. I'm going to do one more loop on each side. A baby's risk of having a CHD is increased by 3 times if the mother, father, or sibling has a CHD. So, unfortunately, because Kevin had a CHD, which we didn't know until after we found out we were pregnant, actually increased Jacob's risk. All right, so I've gotten 6 loops on each side with a center loop. Now I'm gonna cut the ribbon. I'm gonna cut it a little extra long because I'm gonna make tails to my bow. So what you're just gonna do, you're gonna take it, you're gonna loop it around, then you're gonna take your pipe cleaner, run it through the middle where you've pinched your ribbon and twisted, and you're gonna tighten it down. Make it twist until it's nice and tight so it holds that bow nice and firm. And then what you'll do once that's, you just kind of pull the loops out to kind of give your bow a more rounded shape. As you do it, you kind of fluff your loops out. Got a nice bow. And then you cut your tail. Now I like to do a little forked tail. So I fold it in the middle, then I fold it in half, and then I make sure you have nice sharp scissors. Makes it easier to cut through your ribbon. These scissors have seen better days. And then you have a nice bow. And now I will use my bow to kind of hide some of the workings of the wreath. Using the pipe cleaner again to kind of hold it to the wreath. And I twist nice and tight, kind of fold it under. And there you go. A CHD awareness wreath. Really simple, but really cute. Can be put on a door with a simple wreath hanger. But Yep, and any way you do it, it doesn't matter. It's just what looks good to you. And you can do this in any colors. I just like these colors because congenital heart defects. Well, thanks for watching. I hope you learned a little bit more about congenital heart defects. And I hope you enjoyed watching me make this wreath. Thank you.